Hi, everyone. Thank you for joining us today. We'll be starting very shortly. We're going to give people a little bit more time to join, and we'll be back in just a moment. Good afternoon, everyone. My name is Don Squire, physical therapist and director of Spears Physical and Occupational Therapies Penn Plaza Clinic. I'd like to welcome you back for those of you who have attended one of our webinars before, as well as welcome those of you who are joining us for the first time. We appreciate you taking time out of your busy day to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years, with currently 21 locations located all over the NYC area. We have successfully continued to offer in-person care throughout the COVID-19 pandemic, as well as have launched Spear Live for those of you who are looking to stay in and receive care using telehealth platform from the comfort of your own home. In our clinics, we are strategically going above and beyond CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you feel most comfortable. If you are looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience, and we'll get you set up with an appointment right away. We are excited to be here with you today to discuss jaw pain and how it relates to the temporomandibular joint, or the TMJ joint as commonly referred. We'll be discussing TMJ anatomy, common dysfunctions and their causes, as well as treatment methods to address and improve these conditions. As part of our session today, we'll be talking through and demonstrating some of these exercises. And we welcome you to follow along and practice with us as you feel comfortable. Please note that if you're experiencing any pain while performing any of these exercises, or you feel unsteady or unsafe to do them on your own, please stop and reach out to us directly so we can support you. As you can see, we are coming to you live from our own homes. And although we do not anticipate any technical issues here today, please be patient with us if any should arise as we are navigating working through the new technology of the day. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature to the bottom. To find where that is, please take a moment to hover your mouse over the bottom of your screen, and you will see a Q&A option pop up. That is where you'll put your questions, and we will do our best to address as many of them as we can during the webinar. It is best to put the questions in the Q&A section rather than the chat feature so we can see them, and that way we'll be likely to get to them during the webinar. For those of you who are watching through YouTube Live, we are monitoring the comments section as well, so please feel free to type any questions in there. Lastly, there will be times where multiple panelists are on the screen. For the best viewing experience, please select Gallery View at the top right corner of your Zoom screen, and you'll be able to see the multiple panelists all at one time. So I'd like to take a second to talk about what our goals are for today. First, we're going to be covering to learn the anatomy and the physiology of the temporomandibular joint, or the TMJ joint. We'll be understanding the common causes and symptoms of temporomandibular joint dysfunction, and we'll be working through exercises and postural training, ergonomic adjustments that will help relieve symptoms and help improve the quality of life. Before we get started, I'd like to take a second to introduce our team of panelists. We're going to welcome everyone to the screen now. Perfect. Here's our two presenters. Our presenters today are Ryan Grunseich and Jon Bernfeld. How's it going, guys? Jon is the Assistant Director and Physical Therapist at our Penn Plaza location, and he does extensive work with TMJ patients. Ryan is a physical therapist from a Union Square office and also has an extensive history working with TMJ patients and looks forward to really getting into some of the treatment today. Lastly, I would like to introduce Tom Anderson, who is a physical therapist and our clinical director of our Midtown East 56th office. He'll be helping us with answering questions today in the Q&A section. Just a reminder to everyone, it is best to view this in gallery so you can see everyone at the same time. If you've done that, you'll be able to see all four of us right now. All right, let's get started. Ryan, Tom, and I are going to say goodbye for now. Jon, we'll let you take it away with some information on the anatomy.
Thank you, Don. Appreciate it. And welcome everybody to this TMJ webinar. We're really excited to share what we have today. And we're going to get started by actually asking a poll question. So the question we're going to ask everyone to just kind of get a feel of who's involved is, have you experienced jaw-related pain? A simple yes or no. Just so we get a better understanding of, the population we're talking to. And it's okay if you haven't, it's still very good information just to kind of keep up and understand if you know someone who's had it or if you've experienced in the past. Beautiful. Okay, so it looks like a lot of people who are tuned in have experienced jaw-related pain. Now, before we get to understanding why you have this jaw-related pain, I always want to start with the anatomy of the jaw itself. So if we go to the next slide. So essentially what we have here is the anatomy of the temporomandibular joint, otherwise known as the TMJ. So if you could see, it consists of two bones. On the bottom, you have your mandible. That's that big jaw right here. And on top, you have the temporal bone. They connect to form the TMJ. Now, as you can see, in between those two bones, you have that little pink wheel, what we call an articular disc. Now, the role of the articular disc is to essentially provide a cushion between the two bones so they don't rub against each other. And on top of that, as the jaw opens, it wants to prevent those two bones from rubbing each other. because there's a little articular eminence on that right slide that you could see, and they want to prevent the actual two bones from grinding into each other, so it almost acts like a squeaky wheel. So that's essentially the basic anatomy of the jaw itself. Now, before we get going into how all this leads to pain and some different symptoms, we want to ask another quick poll question. So on the next slide, question is, if you have jaw-related pain, do you do any of the following? Do you grind? Do you clench? Do you chew aggressively? Or smile too much? So these are the 4 basic answers. If you don't have any of them, you can leave it blank. And if you have multiple of them, just choose the one that you think you do the most. And these are kind of going to give us a basic understanding of more details to the jaw itself. So we're just going to wait until everyone we get a good amount of people that fill it in, and we're going to go from there. Beautiful. So as we can see, there's a little bit of a drastic, I appreciate the people that chose smile too much, but clenching is coming in at 63%. So it's fair to assume that a good percentage of the people who have had this jaw pain find that they do clench. Now, the reason this is so important is we're going to explain how that could start affecting your jaw. So if we go to the next slide, what we're going to go over are we call the muscles of mastication. So essentially, these are the muscles responsible for closing your jaw. Essentially, the muscles are used to chew or even just to close it in that regard. Now, the 2 major muscles are in front of you. You have your temporalis muscle, and you also have your masseter muscle. Now, there are some other muscles involved. However, they aren't typically as involved as these 2. Now, the reason these are so important is because imagine if you find yourself grinding or clenching your teeth a lot, you just kind of consistently contract those muscles repeatedly over and over and over again. And there's 2 things that happens in that instance. A, the muscles are going to start becoming stronger and stronger, and eventually they're going to become fatigued from having to be worked this whole time. Now, the problem with why this becomes an issue is because A, the muscles are going to start becoming bigger, but this can also lead to what we call TMJ dysfunction. So if we go to the next slide, what ends up happening sometimes is what we call disc displacement. So if you remember the initial slide with the anatomy of the jaw itself, we had the little pink articular disc that allows the 2 bones to slide and without grinding against each other. But if you can see in front of that pink disc, there is a white thing connecting to what looks like a muscle. Now, this muscle is what we call your lateral pterygoid. Now, the reason this is important is remember, going back to people who have a fairly common symptom of grinding or clenching, that masseter and temporalis muscle are getting stronger and stronger. The muscle responsible for opening your jaw, which is the lateral pterygoid, will then have to work even harder. And the problem is, if that muscle is going to start working harder, it could potentially yank on that pink disc too far forward. And essentially, that is what happens when we call disc displacement. So typically, a common symptom of the grinding or clenching has now, besides for the muscles becoming fatigued and inflamed, has potentially led to what we call disc displacement. So every time you open your jaw, instead of that little pink squeaky wheel that prevents the 2 bones from rubbing against each other, you have that little gray bundle. And that's kind of not meant to do the pink squeaky wheel. And that gray bundle is connected to a little nerve bundle. And nerves do not like being irritated. When a nerve feels that it's irritated, it's going to tell any muscle in the surrounding area to start tightening up to provide stability. So what started as potentially this grinding and clenching sensation led to that masseter overactivity, potentially led to the pterygoid pulling that disc too far forward, and has now led to problems. Now, on the side next to it, you can see what we call locking. So essentially what ends up happening is that because the disc is no longer where it's supposed to be, allowing the jaw to open and close, it's preventing it from going back in its place. Or it could go the opposite way when it's trying to open, because it doesn't have the squeaky wheel, it just kind of gets stuck. And essentially that all stems from the disc displacement as opposed to it being in the right position. Now, sometimes a lot of people feel that they hear clicking or popping. What that ends up happening is that the disc is not fully displaced, but it actually is slightly displaced, and then it goes right back into its joint. And essentially that's also leading from an imbalance between all the musculature and the jaw mechanics. Now, on top of understanding how that disc could become displaced, when we talk about TMJ, we have to talk about the jaw mechanics itself. Now, if I'm just going to use my hands as a simple example, imagine this hand is the bottom jaw and this is the top. So when I try to open my mouth and it kind of opens like this, a lot of times, the way the jaw is normally supposed to work, the bottom slides down almost like an elevator and rotates on its axis. However, this is when we go into dealing with why posture is so important to the actual jaw mechanics itself. So on the next slide, this is how posture is related to your jaw itself. So as you can see, the more forward your head tends to go, the more tension is starting to go through your neck. But more importantly, dealing with the jaw itself, imagine the normal is it's supposed to drop down like an elevator and rotate on its axis. However, if my head positioning is like this, where it's too far forward, what my jaw wants to do, instead of being able to drop down, it kind of yanks itself forward, further irritating the actual jaw musculature itself and kind of not letting anything calm down. On top of that, preventing the actual jaw from working in its normal mechanics, oftentimes people have symptoms of having these tension headaches. Now, a tension headache, just to summarize it, it actually starts from the base of your skull. The muscles in the back of the base of your skull are actually pulling on the two bones on the backside. And then what that leads to what we call referred pain. So referred pain is essentially the actual problem is starting over here, but it could actually travel all without messing up my hair, travels all the way to the front of your temples and actually to the jaw itself. So on top of just affecting the jaw mechanics, pain coming from your neck can actually travel all the way to the jaw itself. Now, that's kind of just a quick summary of how the actual jaw mechanics work themselves. But the idea is now understanding if you do have that grinding or clenching sensation, you can understand how it relates to the jaw. Now, just as a common understanding, prior to COVID, we would maybe see about 4 to 5 TMJ patients every couple months. Since COVID has started, it's probably increased about 4 to 5 times a week. So a lot of people are experiencing a lot of these symptoms just based off talking to certain dentists and doctors. They're not necessarily sure. Stress definitely has a lot to do with that. And increasing the stress will increase more of that grinding or that clenching. I have a belief that masks have to play in it as well. It kind of alters the way our jaw mechanics work themselves. But it's just kind of good to understand that a lot of people are experiencing this. Now, based off that understanding, what we want to do now is actually want to slide it over to Ryan. So he's going to go over a lot of interventions that could actually help you relieve any kind of pain you're experiencing in the jaw and try to help any of the symptoms you may be having. So Ryan, welcome on.
Thank you, John. So to start, my name is Ryan. I'm going to be taking you through a little bit of education and different interventions that you can give a try at home there. All right, so you can try at home. So we're going to move on to the first slide, which is a little background on education. So we can move to the next slide, please. Can we move on to the next slide? Yeah, perfect. So the major education I really want to talk about right now is the neutral alignment of the mouth. So the neutral alignment of the mouth is going to be teeth apart, lips together, tongue on the roof of the mouth. That's kind of like the natural resting place for the mouth. So if you find yourself as a big teeth grinder or clencher during the day, and even during night, this is what I want you to really focus in on, trying to maintain this alignment during the day and trying to catch yourself throughout the day. The hope is that if you're really grinding at night as well, making this adjustment during the day will eventually transition into this position while you're sleeping as well and prevent that excess grinding and clenching that you may be experiencing. Another big thing is if you find yourself as more of a mouth breather and don't tend to breathe outside the nose, try to do your best to really focus on breathing in and out through the nose rather than the mouth. The main reason for this is as you breathe out the mouth, you cause a little extra extension at the neck. That's going to cause all those neck muscles to fire in and overwork a little bit. And that can definitely lead to some of that referred pain and tension headaches that Jon was touching on a little earlier. So from here, I'm going to go into a couple of different like stretches and strengthening exercises that you can definitely try at home. So we're going to start with back and chest. So as Jon talked about earlier, posture plays a key role in the tension of the jaw and the neck and all those tension headaches that people may or may not be experiencing. So with all my patients, I really like to address the thoracic spine and just the chest in general. So on the slide here, you can see a couple of images. The first one is a little stretch for the thoracic spine, which is the upper back area. In this picture, she's using a bench. If you don't have a bench at home, an easy solution is using a coffee table, dining room table, a counter, just anything that you have kind of available to yourself. All you're really going to do for that is just place those elbows around the counter and kind of lean the head down in between them, trying to get a little extension into that upper back. If it's really tight, it's probably going to feel pretty comfortable, actually. The next one here is going to be a little pec stretch. This is going to help to open up that chest. It's not uncommon for there to be a little tension and stress, and that can tension in the chest, which can pull your shoulders forward, pull your head forward, and kind of manipulate that posture, and again leads to that increased tension in the jaw and the neck. The easiest way to accomplish this stretch is just like in the picture here. You're going to find a nice little doorway, get both those arms up on that doorway, and then slowly take a step in. I typically tell patients to walk in with one leg and then to walk with the other leg on the second time. And if one side felt like more of a stretch, to use that for the third one. For both of these stretch, it's going to be generally I suggest holding for 3 times 30-second holds, and then doing that anywhere from 2 to 3 times a day, depending on how it feels. All right, and then from here, we're going to go into some stretches for the neck. So 2 of the most common stretches that I like to give to my patients for TMJ are going to be stretches for the upper trap. So that's going to be the muscles in the back of the neck here, and stretches for the sternocleidomastoid, which we call SCM for short, and those are the muscles right in the front of the neck here. So these muscles tend to be rather tight and also tend to refer a lot of pain into the head, which causes a lot of headaches. So for these stretches, the first one I'm going to demonstrate a little bit. All you're going to do is grab the back of your head with, if we're stretching to the left side, we're going to use the right arm. We're going to grab the back of our head, kind of tilt the head to the side. I typically tell my patients to play with that angle, so try looking up and down. If you find a particular spot where you get a really good stretch in the back of the neck here, you're going to kind of hold it into that area. And again, for this one, you're going to want to hold that for about 3 sets of 30 seconds to both sides. If one side feels particularly tight, I would definitely focus on emphasizing that side throughout the day. And again, probably aim to do this anywhere from 2 to 3 times a day. The next stretch, which is one that I find patients are a little more confused by or unaware of, is the stretch for the SCM in the front of the neck here. So these muscles tend to be fairly tight for people, especially in the modern world, since we spend a lot of time bent over a computer or bent down looking at our phones. So that causes these muscles to get really shortened up and really stiff. The way I kind of describe stretching that area is you're going to find that collarbone, take your hand, hold it down. So if I'm stretching out to the left side, I'm going to hold down my right collarbone, move my head to the left, and then move that head up and down. And again, play with that angle. If you find a particular angle that feels really good, you're going to hold it there. You kind of expect to feel that stretch anywhere from behind the ear all the way down to that collarbone. If you're feeling up in the ear, that tends to mean you have a lot of tension in that muscle, and this is going to be a really good stretch for you. And again, I typically suggest going to both sides, and if one side's a lot tighter than the other, definitely making sure to emphasize that stretch. But then otherwise, 3 sets, 30-second holds, 2 to 3 times a day typically for this stretch. All right. So now from there, we're going to move into some different jaw strengthening stretching tests. So I'm going to demonstrate these as well. The first is going to be some jaw stretching exercises. So the first stretch is going to relate to jaw opening. So if you find that you have a lot of tension in the jaw or a lot of trouble opening, this is going to be a great one for you. Typical mouth opening is about 3 knuckles wide. So if you take 3 knuckles and open your mouth, if you can't fit 3 knuckles between the upper layer and bottom layer of teeth, this is going to be a great stretch for you. Just a little test of how that would look. Yeah, so you should be able to get those 3 knuckles in between all the bottom layer and upper layer of the teeth. So the stretch itself, it's going to involve putting the thumbs on the upper layer of teeth, the index fingers on the bottom layer of teeth, and pushing up with the thumbs and down with the index fingers. So you're going to place the thumb in the mouth, and I'm just going to demonstrate that right now. You should feel a nice little stretch on the sides here, maybe even into the back behind that ear, depending on how stiff or tight you are. So for the all jaw stretches and strengthening exercises, I typically lower down the amount of holding because those muscles are a little bit smaller and tend to get a little bit flared up quicker than, say, the neck muscles of the chest or the upper back muscles. So the usual thing I suggest for these is anywhere from 15 to 20 reps with a 5 to 10 second hold. And you kind of gauge that for yourself where you're at in those numbers. That's usually a good area to shoot for these types of stretches and strengthening exercises. The next stretch we're going to address is a lateral deviation for the jaw. So all that really means is moving the jaw side to side. So the way I would describe this one, if you're going to be stretching out to the left side, you're going to take that left hand, place it on the head to kind of stabilize the head and make sure you're not just pushing the whole head instead of the jaw. The next thing is making sure that you have the teeth and lips separated just enough so that you kind of see through it. So just like, and then you're going to take that right hand, in this case we're stretching to the left, you're going to take that right hand and push the jaw to the left side. Again, holding that for anywhere from 5 to 10 seconds for 15 reps. And then I would typically suggest going to both sides and seeing which side feels a little stiffer or tighter to you. If one side feels a lot stiffer or tighter, definitely emphasizing that side. And just also making sure, like I said earlier, that when you're doing that stretch, it's really coming at the jaw and not at the head. So it's more like, and not that. Our next stretch is going to be a jaw protrusion stretch, which is just a fancy way of saying bring the jaw forward. For this one, I typically suggest taking those thumbs, hooking behind the back of the jaw here, and then pushing forward while bracing with the fingers on the front of the face here. And all that's going to really do is feel like this jaw should be feeling like it's moving out forward. And it's important to put the hands here to make sure you're really getting a stretch at the jaw and not just, again, moving the whole head or a whole neck forward and really focusing on the mandible of the jaw there. And then for our last stretch, it's going to be a jaw retrusion stretch, which is also just a fancy way of saying bring the jaw backwards. So for this one, there's a couple of ways you can go about it. The first step is really making sure to keep the lips and teeth separated just enough so there's some room for the jaw to move around. I usually like to say putting the web space of the finger right below the lips and right above the chin, like kind of right in that notch here. Once you're in that position, you're going to get the web space right here, open the jaw just a little bit, and then push directly back. Depending on how tight you are, you may feel that all the way up into the back of the ears, or rather just in front of the ears, near like the condyles that John was talking about earlier. If it's really irritating, definitely ease up the amount of force you're putting through there, but just put it to a tolerable amount of pressure. From here, we're going to move into some nice jaw strengthening exercises. So a lot of the jaw strengthening exercises use similar hand placement, but there's a little subtle changes and differences here. So the first stretch we're going to go over is just a jaw opening stretch. So for this one, the first thing you're going to do is open your mouth to the point of tension. You're just going to open your mouth. If you start to feel like a little stiffness or tightness at some point when you're opening, that's where you're going to stop. Once you hit that point, you're going to place your fist directly under the mouth. And then try and open into the fist with the fist blocking the mouth. So the jaw is trying to open and the fist is stopping it. Again, for these, I would recommend usually anywhere from like a 10 to 15 reps with a 5 to 10 second hold. As you first get into them, you might need to gear more towards that 5 second hold 10 rep, but as you get a little bit stronger and better, you can definitely move into like higher reps and higher holds. Our next stretch is going to be, next strengthening exercise is going to be a jaw lateral deviation exercise. So if you remember from before, for the stretches, that's kind of moving the jaw side to side. For this one, it's going to be the same hand placement as the stretch. The major difference is, whereas before we were moving the jaw to the side, in this one, we're going to be applying force with our hand, and the jaw is going to be resisting that force. So the hand's trying to move the jaw, and the jaw is not letting it move. So the first thing I would suggest, putting that hand right on the head, open the jaw just a little bit so those teeth and lips aren't touching, and then putting some force through it with the opposing hand. And just trying to keep that jaw in a neutral alignment while it fights the resistance of that hand. So if you find that you're putting a lot of force in and the jaw is moving all the way out to the side, probably putting a little too much force in it and getting a little bit more of a stretch. You want to try and really keep it to where you can keep that neutral position, just get those muscles to fire. I usually suggest putting both sides. If one side feels a little weaker or more tender or irritated, that's probably a little weaker side and going to be the side you should hone in on if you had to choose just one. But it's typically beneficial to go after both sides. For our next stretch, this is going to be our next strength exercise. This is going to be a jaw protrusion. So like I said before, protrusion is just a fancy way of saying like bringing the jaw out. So for this one, it's going to be kind of similar to the jaw retrusion stretch in terms of placement. So once again, keeping those teeth and lips a little bit apart, just so there's a little bit of space. Taking that web space of the hand right below the lips and right above the chin, kind of around that notch. Putting a little force posterior into the jaw. The only difference here compared to the stretch from before is rather than the jaw push back, the jaw is fighting that force and trying to stay in a neutral position. And again, 10 to 15 reps for about a 5 to 10 second hold, and kind of work into those reps or work into those holds as you feel more comfortable, or get a little less stronger, or get more strong in the jaw. And then our final jaw strengthening exercise is going to be a jaw closing exercise. So for this one, it's going to start out similar to how the jaw opening strengthening exercise work. You're going to first open the mouth when you first notice like a little tension or resistance. So if I'm opening here, and that's where I feel tightest, I'm going to hang out right there. Once I'm at that spot, I'm going to take 2 fingers or 1 finger, put it on the bottom row of the teeth, and I'm going to try and close the jaw with my finger resisting that force. So it's going to open the mouth and try and close into there. You can also try with 2 fingers. And again, you're looking for like a subtle engagement of the muscles and making sure you're not providing so much force that you end up biting down on your fingers. So those are all like some straightforward and simple stretching and strengthening exercises for the jaw, as well as for the neck and the upper back and the chest. Just some easy ones that people can try, that you guys can try at home. From here, we're going to just move into a couple of behavior modifications that I want you to try to make throughout your day if you find yourself suffering from TMJ issues. So the first major one is just trying to decrease or eliminate any like overuse of the mouth throughout the day outside of necessities. So necessities are really going to be like eating, drinking, yawning, having to talk. The things that look to eliminate are going to be like gum chewing, chewing on pens, nail biting, things of that nature. Anytime you don't need to be using the mouth, trying to avoid it. The next biggest modification, which is the one we started this whole thing off with, is going to be that neutral alignment of the mouth. So really aiming for that lips together, teeth apart, tongue on the roof of the mouth. Trying to do that as consistently as you can throughout the day, particularly if you find yourself as a teeth clencher or grinder in your sleep. We typically find that making that change in the day will eventually transition over to the nighttime and to sleep. Next is no sleeping on the stomach and trying to avoid an excess extension or pressure on the mandible when lying down. So we typically suggest trying to stay on the back or maybe onto the side, depending on how you sleep, but just trying to avoid any excess pressure on the front of the mouth, or that would push you into a hyperextension of the neck. And then any miscellaneous habits, so gum chewing, nail biting, which we talked about earlier. And then really keep an eye on those stress-related triggers. So a lot of like issues in the jaw and neck are really linked to stress. Oftentimes people find themselves clenching a lot more during periods of stress. So really trying to take the time to recognize those periods, whether you know you have like a test or a meeting or just something that you know causes you stress. Taking a minute, trying to just relax, be aware of that clenching, finding that neutral position, and just not letting yourself fall into those bad habits. And then the last one is really just going to be trying to maintain that posture. So try not to like sit with like a slumped shoulder or forward head, and really getting upright, bringing those shoulders back, neck into a neutral alignment. If you have a laptop or a screen at home, really trying to make sure that you're aligning it so it's at eye level and you're not hunched forward, shortening the muscles in the neck or aggravating the muscles in the back of the neck, and just finding a nice comfortable sitting position. Now I would just like to invite back Don and Jon for some questions.
There we go. Welcome back. Thank you, Ryan. Thank you, Jon. That was great. So we have a whole host of questions here, especially in the Q&A. I'm going to try to get through all of them. You know, that was a lot of information and a lot of good stuff. So I'll start from the top and start working down. Ryan, I think you just kind of spoke in this a little bit. So I have a couple questions about sleeping. So one question was, what position, like with the jaw, mouth, and tongue, do you have a recommended position for that? Someone said they understood about neck position to help prevent neck and facial tension, but was there any recommendation from a jaw perspective?
So the recommendation is really going to be that neutral alignment. So that lips together, teeth apart, tongue on the roof of the mouth. Trying your best to maintain that. The hard part about that is while you're sleeping, you're not as well aware of like what you're doing. That's where that really making it a habit throughout the day comes into play. Because we typically find that after a few weeks, if someone's really proactively trying to maintain that during the day, that will transition into sleep. Other options could include reaching out to dentist or so, trying to get a night guard if you're really having trouble clenching to just keep that jaw in that neutral alignment and prevent that excessive grinding of the teeth.
All right, Ryan, I got a couple more for you, Ryan, in the same wheelhouse. So I got two questions about pillows. One, any recommendation on a certain type of pillow or ergonomically what would work? And does that change for a side sleeper?
Yeah, so I'd say pillows are definitely a harder topic. There's a ton of research out on saying like this is the best pillow for this is the best pillow for that. At the end of the day, the best pillow for you is really going to be one that you respond well to. For some people, that's going to be a firmer pillow. For some people, that's going to be a softer pillow. The main point, though, is you want to make sure whatever pillow you're using, it keeps your neck in a neutral alignment. So if you're lying on your side, you're not tilted to the side like this. You're maintaining a neutral alignment. So it's kind of taking up that space between your head and your shoulder to keep you right here. And then typically, if you are going to be like a stomach sleeper, which some people are, trying to avoid that firmer pillow because that's probably going to put a little bit more pressure into the jaw or to the neck, whereas a softer pillow you might sink into a little bit better. But at the end of the day, it's really trying to find a pillow that doesn't aggravate your symptoms.
Awesome. All right, and the last one I have is, so any thoughts on like people wearing night guards at night, if they're still having any sort of clenching or grinding, any recommendations on what to do if you already have taken the first step on getting a night guard?
Oh, yeah. So I would definitely say if you have tried the night guard and you've seen like little relief from it or not a lot of benefit from it, I think one of the best things is really either trying to implement some of these exercises or trying to reach out to a PT and get into the office. We can definitely take you through a lot of different exercises, both strengthening for the jaw, neck, and back, and probably cue into things that you yourself aren't even aware of.
Thanks, Ryan. John, for you, so when
Can I actually add on about the night guard question?
Yes, please, go ahead.
Yeah, I noticed a lot of people are asking about the night guard. It's a fairly common intervention. A lot of dentists prescribe to their patients if they're even somewhat familiar. A lot of dentists aren't necessarily familiar with prescribing a night guard. Now, a night guard is really important because essentially the concept of it is it prevents the top to the two teeth to be touching into each other. It's almost like a block to prevent you from actually clenching. Now, that's great in theory. However, if you have the wrong night guard or the night guard is fitted incorrectly or improperly, it could actually make the situation worse. It could actually put your jaw into a specific position that actually starts irritating all the musculature of the jaw itself, which will then give you more symptoms that you weren't even starting off the bat. And that's a lot what Ryan said in terms of having to keep your jaw neutral. That's typically always the prescribed recommendation, but having a proper night guard and having a proper night guard fitted correctly by someone who knows what they're doing is extremely important. And that's something you should always look into, which again, Ryan, as PTs, we're familiar with the people that know how to do it well. And that's something we always like to work with because not everybody knows how to do this correctly. So it's always really important to make sure you have a properly fitted night guard.
Nice. Thank you, John. John, I want to go down that same realm and talk a little bit about, you mentioned proper fitting. So if someone's looking for the first step and help with TMJ pain, is this something that we go to a dentist for, a medical, a doctor, coming to PT? What would you recommend as the first step?
Well, oftentimes, a lot of people get bogged down by the fact that grinding or clenching can contribute to it. However, on the PT side, what we find is that we actually do, on top of what Ryan was showing you with all the stretches and exercise, we actually do what we call myofascial release, which is essentially working the musculature of the jaw, kind of relieving any tension in the jaw itself. So even though you might not necessarily be able to solve the grinding or clenching, you can start physical therapy. And it's honestly one of the patient populations that I see the biggest improvement from in terms of PT. And I'm not just speaking that to promote PT, it's actually a major difference. Because the one thing we don't realize is we use our jaw for everything. Whether you breathe, whether you talk, whether you sleep, it's always active. So you can't really rest it. And the ultimate goal is we want to reduce any kind of tension as best as we can. So starting with PT, you can start with PT immediately. Definitely also I would recommend, if PT doesn't help, to actually see the help of either a dentist or, somebody who's well-versed in prescribing the actual night guard and fit it correctly. The other possibility is some people I know are asking about surgeries and injections. Now, the reason why injections are relevant and important is, remember, the initial issue is from the muscle just being overly active and overly tight and pulling on the jaw in certain ways that are kind of contributing to these bad mechanics. So the idea of an injection, Botox, is typically a very common one, but there are others. The idea is that they would actually go to the actual musculature itself, inject it with Botox, which is trying to help relieve any of the tension. So then it kind of all calms down. Now, typically it's more of an invasive approach. The usual conservative approach would be see a dentist and also have the PT on it, because essentially with TMJ, because it is so involved and you just use your jaw for everything, you kind of want to throw everything at it. You want to see a doctor, you want to see a PT, but you essentially can start offering some relief immediately the quicker you get on it.
Thank you, John. I want to keep going down that same realm. We're talking about tension, tightness. I have a lot of questions here, really kind of talking about the connection between headaches and TMJ, as well as someone also asked about pelvic floor related issues, and they heard that there's a connection there. And finally, someone asked about tinnitus. I know that that's a little bit different, but I think that kind of all falls within the same realm a little bit.
Yeah, so those are all great concerns. Actually, the biggest one, headaches, going off the top, it's a fairly common symptom that goes along with it, because like I mentioned earlier, we oftentimes people don't have the greatest posture, and with posture, our heads typically tend to sag forward, which then pulls on the back side of the skull, contributing to tension headaches. And tension headaches you could feel pretty much all the way across, a lot of times in front of the temples and to the bases of the jaw itself, and it could all be contributed from the actual pulling on the back of the skull. Now, the pelvic floor, I'm not necessarily too versed with it, but I mean, if it is one whole mind-body connection, it could be very relevant. It's something I could look into and personally try to reach out to that person. The people who brought up tinnitus, that actually is one of the most common concurrent symptoms. Now, just something I didn't want to go over to get too nitty-gritty, but the actual nerve responsible in the jaw itself is what we call the trigeminal nerve. So the trigeminal nerve is pretty much located right in this area. And what ends up happening, a lot of people have spoken to dentists, have spoken to doctors, they don't necessarily know the cause of tinnitus itself, but just based off my own theory, just working with a lot of patients, if you have a lot of muscular imbalances or muscular inflammation in this area, there's a likelihood it's going to start affecting the actual nerves, and nerves are responsible for both actually activating muscles, but also feeling sensory information. So what ends up happening is that possibly from that irritation to the nerves near this area, you actually start perceiving this ringing or this kind of sounds that shouldn't be there. And there's no necessarily physiological explanation. A lot of people see ENTs or doctors who take x-rays and they didn't see anything. My only theory based off this is that actual muscular tension is contributing to those weird symptoms that someone might have.
Nice. I just want to hop in real quick and just talk a little about the pelvic floor that we talked about. A lot of times with pelvic floor related issues, a lot of it is, they say stress related, really that tightness, it's over clenching. The tightness tends to be something that also relates TMJ and pelvic floor if it's really a tightness, a spasm, an over contraction issue, tends to be very common. The neck, the jaw, and pelvic floor tend to be three spots that happens a lot. So I know that I'm not presenting on this, but we do have TMJ in my clinic, and I know a little bit more about the two connection with really getting involved with learning about it. So just for those people out there that asked about the connection, a lot of that hypertonicity, the muscle tightness, it normally doesn't stop just at the pelvic floor. It's found other spots in the body, and the TMJ tends to be one that really harnesses that. Popping back over to Ryan, I want to talk a little bit about some more treatments. So I have a couple of people asking about what you feel like the most, or is it even possible, the most successful exercise to kind of try to get that disc back into place or really reduce the jaw if it is out of alignment?
Oh yeah. So it's definitely a harder one. I mean, If it's really, it depends like the severity of it. If it's constantly popping and coming out of alignment, definitely focusing on some of that strengthening. So that's gonna be like those resisted opening, closing, lateral deviation ones. So really being able to strengthen the jaw and the facial muscles is gonna be very helpful. Also some of that self massage that John was talking about earlier. A lot of times that increased tension is gonna be part of what pulls the jaw into a poor alignment. So just really taking the like two like index finger and middle fingers, working into some of those tender muscles on the cheeks, all like through down into the jaw, starting up right in front of the ears about and working your way down is gonna be a good way to relax those muscles and may decrease some of the tension or pull you're experiencing. And also like keeping an eye on those stretches that I described earlier. If one way feels particularly stiff or tight, really trying to like stretch into that opposite way and loosening it up a little bit to stop that pull it's experiencing in the back of the jaw. Another option too is really going to be doing some controlled mouth openings. So for all that, that really just involves like placing the tongue on the roof of the mouth and then just opening the jaw. So it's gonna be like, so when you do that, you're gonna have restricted opening because the tongue is gonna be like up on the roof of the mouth. It's gonna stop from opening, but it's gonna give you a little bit more control and also be a little bit of an exercise. So I usually will suggest if you find that you have a lot of like drifting to one side or to the other side, especially on opening, go in front of the mirror, first open the jaw a few times, get an idea of which side you're drifting to, then go through some mouth openings, like place that tongue on the roof of the mouth, opening up, and just try to keep that mouth coming down as straight as possible and not letting it move out to one side or the other, just resting at a neutral alignment at the end of that opening.
Nice. Thank you, Ryan. John, I just want to pop back in real quick. Just in terms of shoulder pain, have you seen anything where like how TMJ can affect cervical pain or shoulder pain as well as also, I know we talked about tinnitus. Does dizziness ever come into your practice?
Yeah, 100%. We'll start with the actual cervical and shoulder related issues. Now, remember, it's all connected. So the jaw has a lot to do with what's going on in the neck and the positioning of it. And oftentimes we find a lot of people who have neck pain, besides for just having poor posture or, postural insufficiencies, what a lot of people don't realize, the shoulder has a lot to do with the neck itself. And just off a very basic example, let's say I want to go grab something. What a lot of people don't realize they do, they tend to shrug up their neck to provide stability to the shoulder to do that. Now, the reason that's a problem is that upper trap muscle runs right over here, and that's the muscle you're kind of overly activating. The upper trap also connects to that base of the skull, which could put your head in a bad position. So as you can see, they all kind of go back and forth and are all interplaced, which is a lot of when we come to physical therapy. We focus a lot on educating the patients of how to use their upper body correctly. There is a right way and there is a wrong way, specifically when moving around the shoulder in relation to the neck. And a lot of that has to do with development of the rotator cuff musculature, which is essentially almost like an undercarriage to the shoulder itself. So you're able to raise your arm up without shrugging up your neck to provide that stability. And that's why pretty much when doing TMJ or things like that, you kind of need a full body approach. Everything is really, a lot of it's involved. And the idea is we want to make sure everything is doing what it can in the most efficient way without causing unnecessary tension to other areas. And once you kind of get that going, your body tends to start calming down because it's doing things correctly. And that's a lot of what we do in physical therapy.
Thank you. This is kind of to both of you, but in terms of disc displacement, it can be with or without reduction. Is there a way at home that you can kind of tease through that on your own? Clicking, popping, exactly how would that work if you're doing it on your own?
Yeah, I'll speak on this. So the good thing is that research has shown that even if the disc has been displaced, your jaw can actually function extremely normally without any kind of discomfort. A lot of what I tell Ryan you could add on to this is reassessing your posture, putting your head back, getting your jaw a little bit more retracted, and putting that tongue on the roof of the mouth and opening and closing kind of almost resets the jaw with the hope that the disc has actually reduced on its own by simply putting the head in the correct posture and reinforcing it with proper mechanics. And that typically tends to resolve a lot of people's symptoms of clicking or popping, and it kind of just gets it into the right spot and all the symptoms calm down. Ryan, anything to add on that?
Yeah, I mean, I definitely agree. I think one of the biggest things is that education component, just cueing people into that proper posture and the proper alignment of the jaw with opening. I would also think just doing some of those strengthening exercises, like as well as that part alignment, but building up the strength of those muscles so they have the ability to support the jaw and like prevent it from having that displacement.
Nice. So I have a couple questions about bruxism, both treatments to deal with that, as well as any info on Botox helping with that.
So bruxism, otherwise known as grinding, now it kind of stems from the same source as clenching. Essentially, there's this tension in your jaw, and you're just kind of contracting it to almost as a exhaust like a car. It's your stress exhaust, and for whatever reason, it's going into your jaw, which is a pretty common way. And a lot of other people do. They tend to shrug up like this. Two common ways to almost act like an exhaust for your essentially stress. So the idea is, a lot of things we talk about, unfortunately, in the physical therapy realm, there isn't much to do in the sense of an exercise to calm down grinding or clenching, but Ryan could add on this. What I promote a lot is taking meditation and deep breathing seriously. The same way we would take lifting a dumbbell to get your biceps stronger, looking at meditation as a way to calm down the jaw and actually focus on relaxing the jaw musculature itself. Oftentimes people have it at night. They don't realize it. So I always typically tell people to practice this before they go to bed to kind of reduce the tension of the actual grinding. Because unfortunately, it's not just something that you could easily control in one bat. It takes a lot of effort and unfortunately mental effort. But the idea is if you can start getting some relief and starting to get your jaw in the correct motion, things will tend to start falling into place.
Yeah, and I think the meditation is definitely a very important component. And I think that also kind of relates a little bit back to like being aware of those stress triggers. So like in periods of stress, it's very common to get that increased clenching in the jaw. So if you have like that test or that big meeting or whatever, that big presentation, whatever it is, maybe even like factoring taking that time to meditate before that or like before getting into everything, just to like reset the jaw and prevent that excessive clenching moving forward.
Ryan, a couple questions for you, and this kind of goes into more of an arthritic source. Someone's been doing this for a long time. Any recommendations or or contraindications to certain exercises if it's more arthritic compared to just a simple, more acute chronic condition?
Yeah, so I'd say if it's the arthritic component, I would first maybe try to focus in on making some of those behavior modifications and like postural adjustments and see if just resetting the jaw and like changing up a few habits here and there is enough to like change it. If that's really not doing any like benefit to you, that's when I'd really kind of focus in on getting like those exercises that we reviewed today and definitely trying to even reach out to a therapist and get into that office because we can really take you through a number of exercises. So the exercises we gave today are some great simple ones, but there's a lot more involved ones that we can definitely walk you to build up that strength. And if you have that arthritis, it's not like a deterrent. Like you should be safe to exercise. Don't let that like popping necessarily deter you from the exercises. The only way to really get rid of that is to rebuild that stability and get a little bit looser and stronger in that jaw.
Something else, Ryan, is just talking about, Jon was talking about how the tightness really can create TMJ problems. Just want to cover a little bit about how the exercises, when you're using those muscles, can be so effective. What about using the muscles? Where is that fine line between overdoing it and really finding the therapeutic source for the muscles activation?
Yeah. So the way I really describe this usually to my patients is using like a pain scale. Like if 0 is no pain and 10 is like the most agonizing pain you've ever felt. When you're doing the exercises, being in that 1 to like 3 range as your ceiling is probably okay, but it should. So like if you're doing an exercise and you have like a 1 or 2 discomfort, but then it subsides right after you finish the exercise within like 10, 30 seconds or so, and doesn't like last for a long period of time, that's an appropriate amount of discomfort pain to kind of push through. If you're getting into that like 4+, 5 range of pain and it's like lingering or like turning into a sharp shooting pain, overdoing it a little bit. The other thing is also being aware that it can take up to 24 hours for like inflammation to like kick in. So that first couple of days when you first implement these exercises, even if you're feeling great that day and that night, wait till the next morning to really see how you tolerated it. If you did the exercises, say like yesterday, and the next morning you wake up and your jaw is really stiff or tight, you probably overdid it a little bit. The next time you go through these exercises, you're going to want to dial it down just a tiny bit and really just paying attention to like not only the day of, but the day after as well, especially when you're first starting these exercises.
This is kind of for both of you, but at what point do you feel like it's time, would you guys say that you feel like it's time to really look at a more invasive intervention such as surgery or Botox? I know that, that's kind of not in our scope, but when do you guys feel like you've given it your full effort with the therapy side and the conservative treatments?
Yeah, so on my end, just a general course of treatment and physical therapy as a general rule is usually about 6 to 8 weeks, but by 4 weeks, you should feel at least somewhat a significant improvement. Now, typically, it kind of depends on the subjective answer. So when we ask a patient, what does the jaw feel like? And, they could say, I'm doing the exercise, I feel good, but the muscles just keep firing, they keep spasming, they don't stop firing. Typically, we try to do what we can in terms of postural stuff and the jaw stretches, but that's typically when I would say maybe it's time to go check in with the doctor, because a more invasive approach like Botox is able to just kind of reset the system. It's not there to solve the problem. It's there to kind of calm the muscles down. And then when you incorporate all the postural things and the jaw exercises that Ryan went through, typically that kind of locks it in. So your mouth feels good, you're doing the exercises, keep it there, and it stays in that realm. Typically, that is a next approach. Some dentists are oral surgeons tend to try to avoid doing surgery actually on the TMJ. There's not the best research out there. It's kind of really a last approach. If you try the injections or a cortisone injection, things like that, and they don't really work, and you still find that it's almost intolerable, you can't live. You can't open your mouth, you can't eat, everything's bothering you. Then there are certain more invasive, either what we call an arthrocentesis, which is essentially washing out the joint with fluid, just kind of flush out any kind of irritation you might be having in the joint itself. And then there are other more really invasive, trying to pull the disc back. It's kind of experimental and the research doesn't really support it. And basically on my end, if you can't avoid surgery, you want to avoid surgery. So the conservative approach is what we always tend to do. And most often, I would say 95% of my patients get a form of relief and almost kind of get it under control. Ryan, how about you?
Yeah, I would definitely agree with that. I think surgery is always going to be your last resort. I definitely say I've had more patients who've gone through Botox than surgery. The one note I would say on the Botox is I've had patients who've gotten responded well, and I've had patients who responded poorly to it. And in my experience, it really comes down to the dentist or the doctor providing that Botox. If they are not sure what they're doing or not very pinpoint what they're doing, more than often they kind of get no benefit from it. But if there is a doctor you've been to in the past and has a really firm understanding of your specific issues, it can be beneficial at times to go to that Botox. But like Jon said, we're big proponents of that conservative route, and surgeries are not that common or often done for this particular issue.
Look, everyone, I'm sorry, but based on time, I got to wrap it up. We do have your questions, and we're going to have your questions so we can reach out to you individually. I just wanted to address a couple. We had a lot of questions about finding the right dentist, the right fit for your night guard, hard or soft. I'm going to go through a little bit more information with you, just so that way you can have the contact info for our two panelists here. Those are more specific questions that we really would like to get to. So, we hope today's talk was valuable and you learned more about the TMJ and some treatment methods and lifestyle modifications to manage or improve your own symptoms. If we didn't get to your question, as I mentioned, we will do our best to reach out to you directly afterwards. We will be sending a handout after the webinar to recap the important facts, as well as the exercises you have to reference. I know many of you did ask for that. As a reminder, your presenters today were Ryan Grunseich and Jon Bernfeld. Both are TMJ-focused therapists. Please feel free to take down their contact information so you can reach out to them directly. I know there were a lot of questions there about specific and night guard fit and also people to go to. They would be a great resource for you there. Our Q&A moderator was Tom Anderson, our clinical director at the East 56th Street office. And I'm Donald Squire, the clinical director of our Spear Penn Plaza location. Please feel free to reach out to us as well with any questions, and be happy to facilitate getting you set up with one of our great therapists. At Spear, we treat an array of conditions from head to toe. And as a reminder, we are open for in-person visits as well as telehealth sessions. Should you feel that you could reach out, that you could benefit from some individualized guidance or treatment, please don't hesitate to reach out. We will be doing everything we can to personally coordinate your care and make sure we set you up with the proper member of our team for the right evaluation. Lastly, at Spear, we will be continuing to host webinars throughout 2021, covering a variety of topics, and we look forward to seeing you there. Please follow us on social media and we will check our inboxes to learn more about upcoming topics in the schedule. Thank you all very much for spending time with us today, and we hope you enjoyed the webinar. We wish you all